Health officials in Suffolk County are warning that cases of pertussis, which is also known as whooping cough, are on the rise. 108 cases were reported in the area last year, and 100 of those are just since late November. Most of the cases are in vaccinated school-aged children and their parents, and there are fortunately no known hospitalizations so far.
Yeah, well, that number means there is a little cause for concern, I guess, among parents. So we have Dr. John Whyte with us today, the Chief Medical Officer of WebMd. Big job, big important title, you know your stuff. And Mike, I know parents have a question right off the bat.
Well, you hear whooping cough and it's sort of maybe in the back of your head. But doctor, first of all, thanks for joining us here in the new year. We appreciate it. It is alarming when you see some of these cases, but what is whooping cough exactly, so we understand what we're talking about?
Yeah, it is alarming. I have young kids, and I also want to point out it can occur in people of any age. We usually see it in younger people, though. And whooping cough really is like the cold at first. So you have the symptoms of nasal congestion, runny nose, a fever, fatigue. But then typically about 7 to 10 days later, you develop this hacking cough. Which in many people can lead to this whoop sound.
Yeah, it's a sound you don't forget. Yeah.
No, you do not. If you hear it, it is scary. And the concern is for especially infants. They can actually stop breathing and have difficulty breathing. So that's what it is. It's the symptoms of the cold, which then develop into this more serious bacterial infection with a cough.
Wow. So this is something that kids get vaccinated for, and yet kids are still getting this whooping cough or pertussis. Why does that happen, and why are we seeing a spike in numbers, doctor?
Yeah, a couple things going on. One is some people haven't been vaccinated to begin with, just because the pandemic, many of us missed appointments. But the other point is it's actually a 5-dose schedule, meaning you get the dose 5 different times. Typically, most of them are below the age of 1, but then after that as well. So people may not be fully vaccinated.
Yeah, doing the full round.
And then, in the past, we were always around other kids in terms of, you remember someone got chicken pox?
Yeah, Doc, can I pick up on that for a second, just so you can explain and help us understand? So when I was a kid in the 60s, right, we had mumps, we had whooping, I had it all. I had measles, I had all of that stuff. But we have these vaccines because we don't want kids to go through all the full term parts of this illness or their complications. Can you just touch on that for a second?
Absolutely, and it's an important point. And you have to remember what we've learned about chickenpox, which is a varicella virus, that can actually lead to herpes or shingles later if you've been exposed to chickenpox. So why do that if it's preventable with a vaccine? Things like pertussis, whooping cough, that can lead to serious illness in infants. And it's the same thing for measles, where we're starting to see a resurgence in some areas of the country. Those can lead to serious conditions. And remember, many of us might live with grandparents or parents who have health conditions. We don't want to subject them to, an illness that we might be able to be okay with if we're young and healthy, but others may not.
Dr. Whyte, before we let you go, and we've got about 20 seconds, we've been hearing a lot about the triple-demic, which is RSV, flu, and COVID. Should we be concerned right now, and how are things looking in our area in the tri-state?
We're starting to see increases in the tri-state area, but, I'd be aware, but I wouldn't become panicky or really alarmed. There's something that we need to watch. The total number of cases is still relatively low, even though it might be an increase than last year. So it's just being conscious and using those practical, techniques that we know about: hand washing, not going to school or work if you're sick, and listening to your body. And staying home if you need to.
Yeah, and we should mention that it was released today that a mask mandate now in effect for all the 11 city public hospitals because of the surge that we're seeing here. I don't want to say surge, they're not overwhelmed, but definitely the heightened concern.
Definitely a lift,
Exactly, as we head into the colder areas.
And it's an important precaution. I mean, I was on a plane, I heard a lot of coughing, I wore a mask on my way home, hadn't worn a mask in a while, but I just felt
every flight.
More comfortable.
Yeah.
All right, Dr.
I'll tell you, I've started to wear a mask in clinic again, just because I don't want to, get something and transmit it, to other
Sure.
people as well.
Makes sense.
Thanks, Dr. Whyte, for joining us and giving us more insight into pertussis, whooping cough, and all the other illnesses we're hoping to avoid this season.
Great to see you.
Stay healthy.